least 33 medical societies have come out in opposition of the Trump administration's travel ban, saying that it could affect the number of doctors in the U.S. and medical research. Well, joining us now with her analysis is Dr. Nicole Saphier. Good morning, Dr. Saphier. Thanks for joining us.
Hi, good morning.
Good morning. So if the ban were not in place, like it is now, if we have an influx of refugees, how does that affect the medical community here in the U.S.?
Well, we've already seen an overwhelming of our system with the implementation of the Affordable Care Act. If we were to welcome, a large amount of refugees, we would just see more an overburdening of our healthcare system, more of the doctor shortage that we're already dealing with. Unfortunately, what people aren't understanding is foreign graduates are critical to our healthcare system. The compassion, intelligence, and scientific research, there's no national boundaries there. So we do have international collaboration that really is vital to the medical system.
Would doctors be completely overwhelmed? I mean, you said there's already a shortage. I know that in the ER, there's so many people that flood the ER. Some people don't even get a bed and they have to wait hours when they go to the ER. Wouldn't this make it even worse for those folks who are already living in our country to get care? Absolutely.
If we had even more people coming who do need medical attention, we already have an overburdened system. We would have more of an overburdened system. However, about a quarter of our practicing physicians right now are foreign graduates. So it's very important to recognize that they are crucial to our healthcare system. And, the urgency in protecting Americans from international adversaries is justified, absolutely. And for this to have a momentous impact, to have exceptions would be, it would lessen that impact. But what we need to see is clarity in the future, what this temporary ban holds for our international researchers, our scientists, and our physicians, so that we can compensate.
How does it work? How do we pay for the influx of refugees that are needing medical care?
Well, I think there isn't an actual plan in sight right now. Expansion of Medicaid has been what we've done predominantly in the past. And that does come from taxpayers' dollars. That's part of what America is. When refugees come in, we do try and take care of them. And if we allow them in, they deserve health care.
Right.
We want to be able to take care of them. We do see different diseases that they bring over here, so we need to make sure that we're equipped to take care of them.
It's so tough, I'm sure, being a physician, because you want to help everyone. I mean, you hear about these stories and cases in other countries, and they don't have the medical care, and children die over something that we would be treated for quickly. So that your heart breaks for them. But the folks here in America, the taxpayers, we're running out of money. So it's got to be tough, especially as a physician.
Anytime that there's an executive order or a big decision anywhere, you're going to make a lot of people happy and you're going to upset a lot of people. And I think the Trump administration is dealing with that right now. They're trying to do what they feel is best for America. By having this executive order, they believe that that is what America needs to be safest. And we as a medical community, we're just trying to figure out what that's going to mean for us.
Yeah, you want to help everyone, but then we have our veterans that aren't even getting help, and they fought for this country. So it's tough.
Exactly.
All right, thanks, Dr. Saphier. Great to see you.